If you're having back pain, we're gonna cover 4 really easy stretches that you can do to get yourself out of back pain. Start feeling better today. But we have to cover exactly why we do the stretches and how we do them. It's really important to know that our brain right off the bat tells us we should stretch. So if we have an irritated area in our low back, our brain says right off, hey, I need to stretch this out and pull on it. Just looking at the anatomy of the back, if I consistently stretch in this area that's exposed where I have bulging disc, I have degeneration, if I'm constantly stretching in that area, that's gonna cause irritation. It's gonna light it up over and over. The majority of the time when we see people with low back pain, they move too much through their low back. They're pushing all the movements through their low back. They're not moving through the hips and they're not moving through the thoracic spine. So the area in the middle is taking on the stress. What we want to do is get more movement through our thoracic spine and more movement through our hips. When we do that, we make the stress that the body takes more diffuse. We're moving it around, and that allows our body to recuperate and heal. The first positive stretch that we'll do is a cross-body glute stretch. So if you have any trouble getting down and putting your shoes on, getting your leg up, putting your shoes on, that's hip mobility. That's movement coming through the hips. If you're feeling in your low back and it's causing you pain in your low back, it means we're moving through the low back. That's our path of least resistance. So we need to create that mobility through the hip to decrease the stress on the low back. So this is with the first stretch right off the bat. We're gonna lay down. There's some really important aspects to the stretch. I'm gonna lay down and I come up and across this knee right here, and then I'm gonna grab my leg like this, grab my leg on with my left hand right here, and I'm pulling up to my opposite shoulder. Right here. I'm holding it for 20 seconds, pulling up to the opposite shoulder. What I don't wanna do is push down. That would cause impingement at my hip. That's gonna cause irritation. So I'm pulling 20 seconds, to my opposite shoulder, and then I'm gonna engage my glute for 5 seconds. 1, 2, 3, 4, 5, and then I'm pulling up to the shoulder again. When I engage my glute, I'm doing a PNF stretch. I'm getting that muscle to fire, and it's gonna relax more. So I'm doing that for 3 sets. So I'll be pushing twice. So 20 seconds, a 5-second push, 20 seconds, a 5-second push, and then 20 seconds into that stretch again. Now notice that my low back is not coming off of the table. It's not coming off of the bed. My low back stays down. If I pull up like this, now it's a low back stretch. Now I'm moving through the low back. I want it to be an isolated hip stretch, so I keep my low back pressed down. I'm coming up to the opposite shoulder, and I'm doing 3 sets. I'm gonna do it on the other side as well. Remember, we don't want to stretch our low back. We're already moving too much through our low back. So we've got to make that movement more diffuse somewhere else. Now, stretch number 2, we need to move more through the thoracic spine. When we look at doing movements, moving around our house, playing sports, anything, I want my Superman emblem, Superwoman emblem, and my belt buckle to stay stacked. So I'm moving through these areas, this stays stacked. I'm moving through my hips, I'm moving through my thoracic spine. I'm not taking all the movement through my low back. So we did a hip stretch right here on the back of the hip. Now we're gonna move more through our thoracic spine and our rib cage. So I'm gonna lay down, same position for the first stretch. I'm coming here, I'm gonna chin tuck right here, laying flat on the ground, flat on a table, and then I'm coming right here and up. If this causes you any type of shoulder pain, just decrease it. Bring your elbows down a little bit more and just be comfortable with it. I'm gonna pinch my shoulder blades down and back. I'm squeezing them down and back, and I maintain my chin tuck. My knees stay bent so my back can stay flat. I'm not arching my low back. So all the movement is gonna come through my thoracic spine. If you have the range of motion in your chest, if you have the shoulder range of motion, then I'm gonna come up into a Y position out here, and I'm pinching those shoulder blades down and back, and chin tucking, back's flat, knees are bent, and I'm holding that. I'm gonna hold this for an entire minute. Now I moved through the thoracic spine, my rib cage. I held it for an entire minute. Now I'm gonna go up into the front of my hips. So stretch number 3 is gonna go through the front of the hips. And I'm gonna get up on this table right here. So I always wanna keep a cushion underneath my legs. Now, underneath my knee, I want to protect it. I'm going to shift forward. My knee is not going to go way in front of my toes, and it's not going to come over to the side inside my second toe. So I'm going to shift forward right here, and I'm maintaining this position. Now, there is a way that you can do this as well in standing, but the best way to do it is isolating here. So you can see that my chest stays with my thigh right here, and I'm maintaining that position. I am not doing this. This is where I see a big problem with what people are doing a lot of times. I feel a huge hip flexor stretch right there, but my back's going into extension and I'm closing down those joints. So I want to stay with my thigh, and I can stretch it just fine without overstretching it. Remember that we don't want to overstretch. Now, same thing, I'm going to do that for 30 seconds, 2 sets, and I'm going to switch sides. We don't want to over move through our lumbar spine, and we have a major hip flexor. Our psoas major is attached to the spine, and it'll pull us into extension. So when we go into that hip flexor stretch, if I come up with my back, then I'm going to be pulling right on that spine. I'm going to irritate it more. What I'm looking to do is decrease the irritation. If you aren't able to get up and down from the ground, you have a problem with your knees, or just moving around is too stressful, then we can do it in standing. So I'm going to stretch the front of my hip flexors. I'm going to come right here, and I'm just leaning into my couch. I'm coming forward with my knee. My knee's not going way in front of my toes, so I want to spread out a little bit more. And then I'm coming forward. My chest stays with this thigh. I want to stay with this thigh so I don't get irritated in my low back while I'm doing it. So I'm maintaining this position, and I'm going to squeeze my back glute right here. It just gives me a little bit extra of a stretch. So I'm going to do 2 sets of 30 seconds right here, and I'll be switching each time, pressing down into it, and I'm protecting this knee, but I'm not going up like this and going into extension. I'm maintaining my chest. It's staying with my thigh as I glide forward, and then I squeeze that back glute right here, and that'll take some pressure off of the hip flexor. We'll get reciprocal inhibition, which means that we're firing up the glute to get the hip flexor to relax. Our fourth stretch, we need to move through the back of our rib cage, the back of our thoracic spine. So now we're moving through the back of the hips, through the front of the hips. So it's 360 degrees. We're moving through the chest, the rib cage, the front of the thoracic spine. Now we need to move through the back of the thoracic spine. So if you're okay to get down on the ground, then, or on the bed, getting on our knees right here, then we're going to do threading the needle. So I'm going to take this hand, slide it all the way over. I'm going to put my hand on top of this one, and then I'm going to drop my head down, rested on my arm, and I'm twisting over to the side. So I'm here resting my head, and I'm pulling. Now with this one, I just do breaths. I do 5 breaths. Just relaxing, do 5 breaths. Twisting a little bit more into it each time. And then I'm going to flip over. If you're flexible enough, you can drop that head down. So I come across and drop my head down like this. Doing 5 breaths. When I drop my head down like that, I'm only going to take about 5% of pressure. I'm not going to be very aggressive with it. 5% of the pressure is on the back of my head, but it pulls that entire chain of tissue. Now, if you can't get up and down from the ground, it's not possible for you right now, then we can do it in standing. So all I'm going to do, I can get across a chair, a bed, like the stairs, your banister, and I grab right here. I drop my head on that arm that I'm stretching. It's pulling the entire chain of my thoracic spine and everything. I drop it right here, and then I'm pushing through my thoracic spine. So I don't want to push through my low back. Remember that we're not stretching the low back. We can stretch the thoracic spine, the rib cage, all of those muscles in that area. So I'm actually pushing, if you look at me from the side, I'm pushing over to the side through my thoracic spine, but I'm limiting the motion in my hips. Now, the same thing, we're going to do 5 breaths going each way. We're going to do 2 sets of it. Try this out. Try these 4 stretches. Do it daily, at least twice a day, consistently for a week. Make a comment on if you feel better. You're going to feel better right off the bat if you're moving through the right areas. Make a comment. Let us know how you feel. Subscribe to our channel. We're posting videos of quality content, exactly what we do in the clinic, how we get people the results that they're looking for, get them back to their number one goal, whether it be playing golf, playing with their kids or their grandkids, going hiking, traveling. You know, a lot of our clients just love to travel. They've worked hard their whole life and they want to do it without pain. To summarize the video, we did 4 stretches. The concepts of exactly where we're trying to stretch and where we're trying to limit motion, that's really important. So getting that background, getting the anatomy, understanding biomechanics and movement is really important. So all we did, we took stress off the low back, we shifted that stress up into the rib cage, the thoracic spine, we stretched the front of it, we stretched the back of it, and then we stretched the front of the hips and the back of the hips. If you do that consistently, then we're gonna take stress off your low back. You're gonna be able to get your leg up and start tying your shoe. I have 2 bulging discs in my back. It does not bother me a bit right now, but I manage it consistently, making sure that my motion comes through the ribs and the thoracic spine, and I make that movement more diffuse. That decreases stress on my low back, decreases the amount of inflammatory molecules in my body, and my body can catch up and can get rid of that inflammation because wear and tear is a normal thing. We're fighting against gravity. So I appreciate your time watching this video. I know that this is going to help you. Try them out and let us know. Get mobile and stay active.